Sure. Hello, my name is Tom Britt, and I am a professor in the Department of Psychology at Clemson University. And I'm also the Prisma Health Research Director for Clemson University. My primary interests are in the area of industrial and organizational psychology and occupational health psychology within that area. So I supervise doctoral students in our IO graduate program. I would say that my primary research interests fall within the domain of occupational health psychology, and I'm particularly interested in the resilience of employees in high risk, high stress occupations. So military personnel, firefighters, police officers, first responders, employees who are exposed to high levels of stress. And so within that area, I'm interested in how do you study the resilience of employees in these occupations? How do you characterize the adversity that the employees are experiencing? Obviously, they encounter traumatic events in the workplace where they might see one of their colleagues be killed, or they might see innocent people be killed. But in addition to those traumatic events, there's also a large number of everyday organizational stressors associated with high workload, working at a time inconsistent with your circadian rhythm, and which is required for shift work, and other types of job demands. So I'm interested, excuse me, in what are the factors that contribute to employees showing resilience in the face of these types of demands? And as well, what happens when employees are not resilient and they develop mental health problems as a result of the stressors that they've encountered during their work? What determines whether they notice the mental health problem, whether they get treatment for the mental health problem? And we've placed a special emphasis on the organization being responsible for making sure that employees get the mental health treatment they need early before problems can get bigger and develop into difficulties that employees have with their home life, potential divorce, and also the possibility and extreme examples of suicide. So I've studied these topics primarily with military personnel, but more recently I've established a research program looking at resilience and stress among healthcare professionals, and specifically emergency medicine personnel, who often get exposed to very difficult events and experience a variety of work stressors. So I've expanded my interest a bit beyond military personnel into resilience among healthcare professionals, but also more recently among firefighters as well. And usually what my graduate students and I do is we look for what are commonalities between these different types of high risk occupations, and what can we do in order to change the system and the organization within which they work to minimize the likelihood of that these different stressors that they encounter at work will have a negative impact on their mental health and their quality of life. To me, the qualities that I admire or require most in graduate students are proactive motivation. So many graduate students are very good at responding when you assign them tasks, or when you have them do specific activities such as review this area of literature, or help design this particular study. But fewer graduate students are proactive, and instead of waiting to be asked to do something, they're proactive in terms of asking what they can do, how they can help. Maybe the graduate students will proactively look for the best measure to assess a construct of interest, or maybe the graduate student will proactively notice problems with a particular study that have that they note, or proactively notice that materials or supplies for a study are running short. And I think those students who are proactive are emerge as some of the stronger students. I think I also admire and select for students who are autonomous and are able to complete tasks and assignments on their own with relatively little supervision from me. So I'm not suggesting that that I won't direct students and be clear about what needs to happen for a particular project. But once that's done, the student's able to complete the tasks or complete the activity without needing to be micromanaged by myself. And I found that that actually works best too for the students. So the students typically prefer to some level of autonomy in terms of how they go about their work and how they complete activities that are going to contribute to the research studies that are ongoing. So how much freedom a student has in choosing their projects is somewhat related to the previous question of where I was talking about the autonomy that students have. I frequently will have graduate students work on a couple of studies that I've designed and that contribute to our research program on resilience in high stress occupations. But I encourage the graduate students who work with me to develop their own ideas, and they don't even have to be in the area of focus that I'm doing at the moment. I've had prior students come up with research ideas that fall broadly within occupational health psychology, even though they may not be technically related to employee resilience. So one of my former doctoral students was interested in the concept of moral injury among employees in different occupations. And so I encouraged her to pursue her PhD on that topic. And typically by the time the graduate student is ready to do their master's thesis and then their dissertation, they're becoming more autonomous and they're becoming more independent thinkers and are having their own ideas and their own research interests. And so I encourage students to explore those ideas rather than insisting that the research topics examined by the student fall directly in line with what I'm doing. So I believe that the students who work with me feel like they have the freedom to explore the research areas that interest them the most, and it also allows me to get exposure to different areas that I'm unaware of, and many times the students pursuing their own research ideas has resulted in me rethinking some things about my primary area of research.